So what is a pelvic exam? So a pelvic exam, basically, patient comes in, we do a pap smear, we do cultures, some doctors do a rectal exam as well, and a pelvic exam, which involves your hands. Rule number one, a doctor should always use gloves. So if your doctor is not using gloves, something is wrong, that's a red flag. Rule number two, always ask for a chaperone. So if anything makes you uncomfortable, female to female, I very rarely have chaperones in my room, but I will if someone needs some comforting or needs somebody else there to be a witness. With males, for sure, you should always ask for a chaperone. That way, even if they're thinking about doing something, you have someone there that is your witness. And then I'll just show you guys like what's involved. So Judy, who is my new nurse practitioner, I've been wanting to introduce you guys a lot more to her, but she's gonna play a patient. And so I'm just gonna ask her a couple of questions that we would normally ask during an annual exam. And then I'll show you guys like actually how you do a pelvic exam. So Judy, welcome.
Hi, thank you.
How are you doing?
Great, thanks.
Perfect. Okay, so you're here for an annual exam. Annual exam, we're gonna do a pap smear and we're gonna do a pelvic exam and a breast exam. The pap smear, typically, if you are low risk, we in general only have to do it once every 3 to 5 years, depending on your previous history. If you've had a history of abnormal pap smears in the past, typically we like to follow once a year, sometimes even sooner than that, depending on the results. So this is a point where I would ask her like her sexual history, are you in a stable, monogamous, you don't have to answer truthfully. So
I am sexually active.
You're sexually active. Are you in a stable, monogamous relationship? So that question is appropriate. I know some patients are like, why are you asking me about sex? We need to know, and we need to know this because that is going to guide how we take care of you. So it's okay. It's appropriate for a doctor to ask you, stable, monogamous, do you have partners? What kind of intercourse do you have? Do you have, penetrative? Do you have oral, anal? Those are all appropriate questions. That is not inappropriate. They're not trying to be, dirty or get the scoop on you. Really, we need to know because anal cancers are very prevalent in patients with HPV. We check for warts, we check for all kinds of different things. So those questions are appropriate for them to ask you. It's also appropriate for them to ask you, do you have sex with men, women, or both? That's okay too, because again, the risk factors are very different depending on the type of sex that you are having, okay? And so then I would just ask, like, are there any other issues that you are concerned about? Any abnormal vaginal discharge? Any bad smelling discharge? Any itching? Pretty much any questions that pertain to the female genital tract, it's okay to ask. They're not being inappropriate. It's just for us to know what we need to do for you. In terms of the breast exam, I always ask for family history, any immediate family members, mom, sister, grandmother with breast cancer. Have you yourself experienced any symptoms with your breast? Ever noticed any changes? Abnormal discharge from the breast? So those are all questions that you would likely get asked during a routine annual exam. And then any abdominal symptoms, so any pain with your periods. Are your periods regular? Have you ever had an ultrasound or any previous history of abnormal stuff? Any previous history of STDs, because STDs can put you at risk for ectopic pregnancies. So those are all questions that we would ask. Is there anything else that you would add, Judy, that you can think of?
I like to tell my patients, also just to elaborate what you said, once you walk in through my doors here, it's a safe haven. So this is where I need you to tell me everything you're feeling, you're doing, not doing, so that I can provide the best care for you. Nothing leaves this room. but I just need to ensure that my patients are safe and I can keep them safe.
That's a really good question, because we get a lot of teenagers that are scared that we are going to tell mom and dad, and maybe won't admit to us that they have issues with, or that they're having sex. That's number one. So I always try to tell them, like, I'm like a vault. This is like you're confessing to a priest. Whatever you tell me is not going to leave this room. And I apologize to the parents out there, but this is to keep your children safe, and so that I can also counsel them and give them some guidance. Maybe you need to be more open with your children and allow them to be able to feel comfortable so that they can speak to them. But when they come to see me, I have to make sure that they can tell me anything and know that I will keep their secret safe. So if you're a mom and dad and you want to get the scoop, it's not going to happen from us, unfortunately.
With that being said, I like to have the parents here when I first meet them, their daughter, but at one point I kind of like to give a gentle nudge to parents to see if they can step out so that I can have that open forum, like Dr. Rodriguez said. I tell all my parents that although I have no kids, I'm an auntie, and I would talk to them just like I would talk to my nieces. So to help them keep them safe, practice safe sex, good self-care, and just educate them. One thing I want to add, if you're noticing that you have either an abnormal discharge, something out of the ordinary for my ladies, take a mirror and get to know yourself down there. And even if everything is normal, just get to know what your normal looks like.
So that you know what abnormal looks like.
So you know what abnormal looks like, or you can just tell when there's something different. I tell people, if you notice something, take a selfie, take a picture, take whatever it is that you need to document so that when you get here, if it's still present, you can show me whether it's changed or hasn't changed, or what it looked like when you first discovered it. So,
that's a really good point. I know, because sometimes our appointment times might be a little bit delayed. We usually try to get people in right away if they're having some sort of like immediate issue that needs to be addressed. But say you saw a lesion and then, you got your appointment a week later and now the lesion is gone, it's helpful for us to be able to see it, and you can kind of document it with the camera. Oh, other things. So photos. Okay, so some patients have asked me questions about photos. So it is appropriate if the photo is being taken for the chart and for the chart only. We do a lot of photos here. Why is it important? Because we can do a comparison, what you had before to what you had after. When we do colposcopies are when we're looking at the cervix under a microscope. Sometimes we take photos of that so that we can compare what the abnormality looked like before to what it looks like after treatment. It is never ever appropriate to take photos without your consent. So anytime a doctor is taking photos, usually you should have an informed consent. And if anything just doesn't feel comfortable, just say, I don't want the photo.
Verbal consent's okay as
Verbal
well.
consent is okay, yes.
If I tell you I see something, may I take a picture of it? If I take a picture of it in the office, I like to show my patients, because you will see me use my personal phone, but this personal phone has been linked to our charting system.
Right.
So when I press upload photos, you will see that it's uploading, and it'll show you AthenaNet. So I show this all to my patients. And it's never saved on the phone. Never saved on the phone. I tell them this, but if you experience that, or if you have questions about that, ask the providers, because I'm very clear as to what it is that I'm doing. So I expect all other providers to be,
So a couple of horror stories that I've heard from some of my patients that were involved in this abuse scandal was that they had doctors that were not using gloves during a pelvic exam. That is completely inappropriate. Every doctor should be using gloves when they're checking you. Another patient was telling me that they were being brought in multiple times for breast exams. Like, that is just unheard of unless there is like a lesion there that they need to check.
I had one patient that complained of her doctor giggling and laughing at an abnormality that she had was normal. But yeah, that just lacked professional. So.
And just know if something just doesn't feel quite right, you need to change providers. You should feel 100% comfortable where you're at, and if you're not feeling that, then it's time to find somebody else. But I'm going to show you guys really quick what we use. So this is a speculum. It looks like a little duckbill. And the way we normally use it, I'm going to use my favorite model. So we insert this into the vaginal canal and then we open it. So when you open it, you can see that now we can see the cervix. Obviously you can see the cervix pretty well here, but you know, normally in a normal person it's not open like this. The vaginal walls are kind of collapsed in, but the speculum does allow us to see it very well. Once we see it, then let me show you guys. We lock it in place, so that will stay in place. And then we have this little guy, which is a cyto brush. This allows us to get the cells on the cervix. So we go in here, we go into the endocervical canal, and then we swirl it around. Are you able to see? Mm-hmm. We swirl it around. So now that has the endocervical component of the cervix. And then we get this little spatula, and the spatula, we kind of rub the cervix up and down. So that gets the ectocervical component, which is the external part of the cervix. Now, if we're doing cultures, I'm not going to open this, but this is where we can test for chlamydia, gonorrhea, BV, yeast. And so it has a little Q-tip, and we'll use that Q-tip also to kind of rub, you know, get off some of the vaginal discharge. And we send this stuff, we put it in this little formaldehyde container. It's a thin prep test. And then we just kind of get all the cells off and send it in this liquid container. And that's part of your pap smear. Other things that we can check for, this is just another different type of swab. This we can check for, like, you know, any abscesses that are on the vulva. We have another little container like this that checks for herpes. So if there's active herpes lesions, it's best to come in right as it's happening. And don't hesitate to call the office and say, hey, I've got an active lesion now. Can you please squeeze me in? Because usually that meets criteria for getting you in right away. If it's not a dire emergency, you will be pushed back. But something like that where we need an immediate culture, it's a good idea to get tested right away. Gloves, again, always, doctors should be using gloves. Please let your doctor know if you have a latex allergy, because if you have a latex allergy, you want them to use hypoallergenic gloves. And then lube is okay. We use lube, and that's just to be kind and gentle, because sometimes we're pretty dry during the exam, and this helps. We never use the lubrication at the beginning when we're collecting the pap smear, because we don't want the gel to distort the results. You can use water, and water is okay to use. A rectal exam is appropriate. So I've had some patients that are like, oh my God, this doctor did a rectal exam, didn't even warn me. First of all, your doctor should warn you. If they don't, I don't think that it's being done intentionally, but they should give a warning. And why do we do a rectal exam? Well, oftentimes there are masses that are between the vagina and the rectum that you can feel, and sometimes it's a dual exam, meaning one finger is in the vagina and the other finger is in the rectum. That is okay. That's also normal. It might feel a little weird, but the reason is there's a very thin membrane of skin separating the vaginal wall from the rectum. So when you put your two fingers, you can actually feel between that thin membrane to make sure that there are no masses there. Sometimes patients with endometriosis, you can feel that that area is very thickened, and so that'll give you an idea of what's going on. So that's okay, that's appropriate, and that's basically it. Do you have anything else to add?
No, I think that's it.
So that's what's normal in a pelvic exam. Please feel free to make any comments, ask any questions. That's us.
We're done.
Yay, we're done.